Well, it's time now for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with the latest news on tackling malaria. Linord.
The World Health Organization says 6 African nations, including Algeria and South Africa, could be malaria-free by 2020. A new study published in the Lancet Medical Journal says the world could be completely malaria-free by 2040. The study reveals that the world saw a 91% decline in malaria cases and 81% reduction of death from 2000 to 2014. In countries working to eliminate malaria in Africa, cases of the disease declined by 95% from more than 618,000 in 2000 to fewer than 34,000 in 2014. The authors of the study say the malaria map is rapidly shrinking as more than 20 countries are on track to eliminate the disease by the year 2020. Now joining us via Skype live from San Francisco, California is Sir Richard Feachem, the senior author of the study and director of the University of California, San Francisco's Global Health Group. Sir Richard, welcome to the show.
Thank you.
Sir Richard is also founding executive director of the Global Fund to fight AIDS, TB, and malaria. Now, joining us via phone from Addis Ababa, Ethiopia, is Dr. Richard Kamwi, an E8 ambassador and a board member of the Rollback Malaria Partnership. Dr. Kamwi, welcome to Africa 54.
Thank you very much indeed.
Let me start with you, Dr. Kamwi. There seems to be a lot of good news there when it comes to fighting malaria. What is your take on this progress, Dr. Kamwi?
Yes, indeed, there has been much progress, significant progress has been made in Africa, especially in the last decade and a half, in responding to the scourge of malaria. However, I must say that challenges, including a huge gap in financing and broader health systems, challenge threaten to stall the progress that is being made.
Okay.
And that when you read yesterday's report, which was launched by WHO, in the year 2000, for example, 13 countries had less than 1,000 malaria cases, and by 2015, that is last year, the number of countries in this category has reached 33. And okay. I do know that the next 5 years will be critical in maintaining momentum.
Absolutely, and we will continue. And Sir Richard, let me come to you. Critical years are coming ahead. In the report, one of the things that you mentioned is the fact that there is a warning that really there is a need for renewed focus, new tools, and sufficient financial support. Tell us about that. What will it take? Renewed focus. What are these? What is it?
Well, the leadership in malaria elimination in Africa is coming from Southern Africa. And Dr. Richard Kamwi is playing a very leading role in this. It is his country, Namibia and South Africa and Botswana and Swaziland, who are really leading the way to demonstrate that African countries can completely eliminate malaria from within their borders. And progress is very good, and we anticipate that those 4 countries will eliminate by 2020 in collaboration with their northern neighbors, Angola, Zimbabwe, Zambia, and Mozambique, together forming the Elimination 8, which Dr. Kamwi is the ambassador for. Now, there are challenges, as you mentioned, and I think the most persistent and systemic challenge is the question of political commitment and financial commitment. Because as malaria becomes uncommon, and then following that it is actually eliminated, political attention moves elsewhere, other health priorities rise, and governments find it difficult to continue to allocate the budgets to maintain an effective malaria control program. And we have a lot of historical experience that if malaria becomes low in your country, and then you take your eye off the ball, because it's out of sight, out of mind, malaria will come roaring back.
And we have we have seen resurgences in the past. Dr. Kamwi, tell us, Sir Richard talked about political commitment with the Elimination Aid strategy in Southern Africa, and also you being on the board of Rollback Malaria. What are you doing? What is the group doing in terms of getting to have this commitment that is needed?
Well, indeed, my good friend Richard Feachem is correct. What are we doing? The major aspect that we are doing relates to advocacy. For example, just yesterday here in Addis Ababa, we commemorated the World Malaria Day, where the main focus was, or the theme was, end malaria in Africa for good. We brought together ambassadors and high commissioners, the entire leadership at AU level, experts from all member states of the AU, and indeed some ministers were present. We have now decided to mobilize, to talk to them, putting emphasis on areas such as the ownership.
Okay.
We advocate for the promotion, of course, of national programs, the ownership by the governments, and of course the private sector and civil society to ensure self-sufficiency on the African countries to eliminate malaria.
Okay.
And another area that we are focusing on is that of mobilization of resources.
And that leads me to my point. Dr. Kamwi, please let me get the reaction for Sir Richard, because we're running out of time. Speaking about funding, Sir Richard, you were heading the Global Fund initially. What can you tell us? Because there are some reports about there is a threat of 31% decline in national funding from the Global Fund. What can you tell us about funding?
Well, there are quickly two dimensions to the funding. One is the domestic funding, the resources that each African country itself will dedicate to the fight against malaria. And those resources are already substantial and are growing. So countries are standing up to their own responsibilities, and Namibia is a leading example of this, standing up for their own responsibilities to use domestic resources to eradicate malaria.
Okay.
But on the international front, the main source of funding is the Global Fund to fight AIDS, TB, and malaria. Okay. And it's important that the Global Fund maintain a focus on the elimination countries in order to shrink the map and get the job done.
Okay, unfortunately, we have to... Unfortunately, Sir Richard, we have to leave it there. We're out of time. Thank you so much both for your time. And that was Sir Richard Feachem. He's founding executive director of the Global Fund to fight AIDS, TB, and malaria, and Dr. Richard Kamwi, board member of the Rollback Malaria Partnership. And that's our health report for today. Thank you, gentlemen. To stay in touch, find me on Twitter at Linord Moudou. Back to you, Vincent.
A very insightful.